presenting Daksha's program to deliver healthcare to destitute and abandoned elderly living in not-for-profit old age homes and shelter homes. Daksha's is a Section 8 company made of orthopedic surgeons, physiotherapists, nurses, and physicians who have come together to design ways of delivering healthcare to the poorest among us. This is how the Daksha system works. We partner with every single stakeholder in the healthcare system, whether they be not-for-profit clinics, specialists, diagnostic centers, trust hospitals, their surgery teams, and provide healthcare throughout the patient's cycle. Allow me to share a story of an abandoned elderly with you who was attacked by street dogs. When the not-for-profit who rescued her connected to Daksha's, we arranged for her clinical visit, diagnostic tests, admission into a hospital, surgery, post-surgery dressings and VAC therapy, and then rehabilitated her in an old age home in Hyderabad. So Daksha's system starts at the time of elderly rescue, where if the elderly is found to be having medical problems, the not-for-profit is able to take these elderly to a trust hospital or a not-for-profit clinic where medical care is given, and then these patients are rehabilitated in the old age homes. In the old age homes, care continues with general nursing for bedridden elderly, fall prevention, physiotherapy, and other pro-health services, which also monitors their vitals and red flags through a remote monitoring telemedicine system. And when abnormalities are detected, the elderly are again reconnected to the healthcare system to access care. This is the external ecosystem support that we have been able to develop with clinics and hospitals with various specialities, who then also contribute to training these nurses and physiotherapists to deliver care in the not-for-profit old age homes. We have partnered and screened around 1,267 elderly so far, provided fall prevention sessions for 898 elderly, specialist visits for 400 of them. We partner with LV Prasad to provide vision screening for those elderly at risk of fall. These have been some of our service partners. Vivekananda Health Center at Ramakrishna Mutt. We partnered with Vijayavani Charitable Foundation, Elder Spring, to provide these services to 40 old age homes. We've earlier worked in urban community health centers to provide physiotherapy services to elderly, NIN. With Pratham, we are launching a rural elderly healthcare program, wherein nurse caregivers from villages who were trained and who have worked in the city for 1 or 2 years go back to their rural communities with all these skills, stay in their own homes, and deliver care to elderly in their villages. During the COVID-19 pandemic, Daksha's was able to provide online training and hygiene kits. We covered 2 cities, Hyderabad and Bangalore, 68 old age homes, approximately 4,500 elderly, out of which 550 were bedridden. 245 nurse caregivers were trained. And these elderly and nurses were monitored twice daily for any symptoms to then escalate them to the healthcare system. We were lucky that none of them developed the infection. All this is anchored on Daksha's senior citizen electronic medical record, which allows us to screen, diagnose, treat, counsel, and support them through their care. The nurse caregiver enters the data on their phones in the old age homes or in rural camps, which is then visible to our remote medical teams, and we are able to monitor their fall risk, red flags, and decide what services are needed. Vitals can be measured. We do it twice daily. The system separates abnormal and normal vitals so that we can focus on the abnormal vitals and arrange for medical service. Vital trends can also be monitored for up to 10 days. And medical records and treatment intervention records are available to the remote teams or the physicians who then provide them care. Going forwards, we also hope to implement soft carpets in the corridors leading to the toilets in these old age homes, grab bars in the toilets with rubber mats, and railings to the bed of bedridden elderly so that fall risk can be further reduced. Thank you.